So good evening, everyone. I'm very excited tonight. I have a guest speaker. You know, we like to change it up on Wednesday night. Many of you, if you're a guest on the line, I'm Dr. Rita McGuire, Chief Medical Officer here at Wakana, as well as one of the co-founders. And tonight we have Dr. Lawrence James. He is going to really talk to us about some really interesting, very deep, very needed information about mental health, substance abuse, and all that goes along with all this anxiety and stress in the African American community, with African American men in particular. But I just want to read his bio first. Lawrence is a thought leader. This guy is so humble. I was just like, are you kidding me? When I read this bio, he is a very humble physician, clinician. He's a thought leader in the area of diversity, inclusion, and belonging, executive development, and executive assessment, showing a powerful mix of inquisitiveness, insight, and drive. He is an innovator, known for his willingness to challenge existing paradigms and create new ones. He has developed a holistic, integrated, and systemic model for growing diverse talent, which has been detailed in his seminal white paper, Journey to the Top, Developing African American Executives. That's what I'm talking about, right? African American executives, as well as numerous blogs. With his forward-thinking and innovative whole organization approach to talent development, he has been invited as a keynote speaker at a variety of conferences, symposiums, and corporate roundtables. Recently, he was selected to be the co-editor of a special issue in the Consulting Psychology Journal entitled The State of Black Leadership: What Can Be Done to Create Sustainable Change, which will go to press in 2022. After 12 years as a partner with RHR International, a premier boutique leadership development consultancy, he started his own consultancy focusing on the systemic development of diverse talent, from assessment to coaching, inclusive leadership training and development, diversity strategy and advisory services, and organizational transformation. He is an expert in helping corporations develop cultures of belonging, inclusion, and diversity so that all employees thrive. We need that here at Roseland Hospital. During his tenure at RHR, he co-created the firm's diversity, inclusion, and belonging practice area and co-led the service. Internally, he co-authored the design, strategy, and intervention plan for the company's own internal journey, which led to an over 40% increase in the hiring of diverse talent, coupled with improved employee engagement scores firm-wide. In addition to his work in diversity and inclusion, he is highly sought after for his ability to assess and grow senior executive and high potential talent. He has worked across numerous sectors, including healthcare, energy, utilities, financial services, and manufacturing. Prior to joining RHR International, Lawrence was president of LJA Life Lessons, a psychological service corporation, for over 10 years. He provided a variety of mental health services, including psychotherapy and neuropsychological assessments. He primarily worked with adolescents and adult populations. In addition, he served as a consultant with a variety of nonprofit designing programs to extend their service reach, as well as providing staff consultation and development. He served as adjunct professor in psychology at Lewis University. Lawrence received his BA in psychology from the University of Illinois at Urbana-Champaign. He received his Master's of Education in Counseling Psychology at Howard University and his PhD in Clinical Psychology from Southern Illinois University at Carbondale. He is a licensed psychologist in the state of Illinois and is a member of several professional organizations. Can you help me welcome Dr. Lawrence James to the stage? This is a virtual stage.
I was about to say, right? It's what an honor to be with you all this evening, and thank you, Dr. McGuire, for the invitation to speak to the organization this evening. It's it's often amazing to have somebody read out your biography. It's both humbling and daunting all at the same time. I told Dr. McGuire the other day, I see myself as Lawrence. I don't really think a whole lot about being Dr. James. So it's a little bit weird and a little bit disconcerting, I must say, to listen to all of that, and makes me think I need to cut that bio down by about 45%. And maybe I'd get comfortable with it. But having said all that, it is an honor to be with you all this evening and to talk to you a little bit. And I'll focus tonight primarily on mental health. If folks have questions around the executive coaching and development practice that I have been in, that I'm kind of focused on today, I'm happy to answer any questions in regard to sort of what's happening in the organizational climate. But tonight we'll primarily focus on mental health, and ironically, LJA Life Lessons, which is the psychotherapy practice that I started, gosh, over 20 years ago, is still alive, and in some ways is being rejuvenated as I've transitioned out of RHR and into my own consultancy practice. And it's an interesting time, I think, to be in behavioral health, mental health services, given what's happened over the last year between the pandemic and the murder of George Floyd. And I think those two things in some ways go hand in hand. We've really seen an extreme increase in the utilization of behavioral health services over this last year. I get way more calls, frankly, today than I was getting a year plus ago for behavioral health services. And I think most of you can guess as to why that is, between the trauma that people experienced in watching the video and the murder of George Floyd, as well as the murders of Breonna Taylor and Ahmaud Arbery and countless other Black men and women, as well as the rise of, or continued rise of racist ideology and practice in this country. I think many persons of color, whether they be Black, Asian, Latinx, are feeling the pressures of all that. And you couple that with a pandemic where literally people, for most of us, the first times in our lives, many of us are confronted with an illness that had no cure and was killing people. And many of us, I think, sat back and thought, I could be next. And so for all of us, just day-to-day living was creating a tremendous amount of stress and trauma. And Lord, for all of you who have kids, adding on to the pandemic was this notion of, one, being at home all day, 24/7, having to try to manage, your kids and their education, as well as their mental health. The stress has been astronomically high, and I will shout out to much of that pressure really fell on women, much more so than it fell on men, for many sort of historical reasons that many of the ladies on this call would be familiar with. So what's the status of where we are today? I think the status is folks have experienced and are experiencing a tremendous amount of distress in their lives. Even small things now are creating a tremendous amount of stress. The other day I was on a panel talking about post-traumatic stress disorder. And post-traumatic stress disorder is really the clinical syndrome we often think of, war veterans, but it impacts many folks who experience traumas, from shootings to unexpected deaths in their family, whether that's actually being shot at or just being exposed to those traumas. But I think there's a level of stress and anxiety that all of us have experienced over this last year that's just kind of everyday, daily stress. And we have it in our lives prior to the pandemic, but it was clearly worsened by the pandemic. And I think we saw a lot of the symptomatology, which looked like heightened levels of anxiety, heightened levels of depression for many folks, sleeplessness, restlessness, that we have seen very much increase for people throughout this last year. A great sense, I think this has impacted so many people in the pandemic, a tremendous sense of isolation that has come with all of a sudden not being able to engage in their normal routine, see friends, see family, go out to dinner, do many of the things that allowed us to socialize over the course of our lives up until this date. And then trying to figure out how do you get some of those social needs met. I know, like probably many of you, I spent a lot of time on Zoom calls, not only for work, but for connection with family and friends. And Zoom fatigue is a for real thing that many of us have experienced. And so we're seeing these very much heightened levels of stress and anxiety that people are experiencing. And for many folks, that has led to depression. And what we're seeing is that with those heightened levels of anxiety, those heightened levels of distress, we've seen catastrophic increases in incidences of domestic abuse over the course of the last year. In some ways unprecedented. I think the levels have always been high in this country and probably throughout the world, but we've seen those numbers go up astronomically high as folks haven't been able to get away and decompress. I think we've seen the rate of suicide has increased also very significantly over that. And so we're all in this sort of collective holding of our breaths and experiencing these very high levels of distress. As people have moved now into not a post-pandemic world, because I don't think we're there yet, but in a world with a vaccine where people have been able to get out more than they had been, I think we are seeing some decreases in the level of distress that people are experiencing. But we're not at the levels that we would say have been normalized by any stretch of the imagination. And coming out of this last year, where people are experiencing a new normal, we are seeing folks really try to identify and understand, well, what is my personal new normal? Because what might be comfortable for me, Lawrence James, may not be comfortable for someone else. And how do you navigate that in a way that feels comfortable for you and really get back into it? I think some folks have jumped into socializing immediately and just like it was, March of 2020. And there are a lot more folks who are much more cautious, in re-entering the fray and experiencing, frankly, a lot of anxiety. I look at the numbers in the state of Illinois as an example, and I think we're overall 70 some odd % have had at least one shot overall. 2 shots is still lingering somewhere in, I think, the upper 50s to low 60s. And if I go out today, nobody has on a mask. And that's disconcerting because I know, at least 30 to 40% of the folks who are out there have not had any shots at all. And so again, that stress in terms of return to normal hasn't been navigated. And so I think for each of us and for all of you who are doing your work around the utilization of CBD as a tool in the toolbox for managing stress, anxiety, and other forms of emotional distress, what else can we be doing? As a mental health professional, I'm a strong advocate for the utilization of psychotherapeutic services to help in that. But there's some things, if you're not going to go that route, that are useful. I think mindfulness practices, yoga practices, those kinds of things that help you to stay in tune with where you are mentally and emotionally are really important. One of the things I said to Dr. McGuire the other day as we were chatting about this discussion is, we're in a world right now that wants to overdiagnose any and everything. You can't watch the television and not have something on that is telling you there's a medication for, you know, every little thing that has ever happened. And I'm sure those medications are effective. I personally, I think taking as little medication as one can possibly take is probably the best thing if one can, and learning to self-manage. So I'm a bigger advocate of meditation, mindfulness practices, psychotherapy practices in comparison to medication. But we also know that people self-medicate, even in the most severe forms of mental illness. We see the correlation between bipolar disorder and substance abuse is high, between post-traumatic stress disorder and substance abuse disorders is very high. And this may be a bit controversial, but I'll say it. There's a reason why people self-medicate. And nobody in my profession really wants to say this, but I'm going to say it out loud. Um, People get high, people drink too much, because in a bizarre way, it actually works. If the goal of getting high is to self-soothe, or to drink is to self-soothe, at some level that works. We clearly would argue that it can be in excess dysfunctional and create other problems. But the human animal is not designed to engage in behaviors that actually will kill itself. It may actually happen, but that's not really what it's designed to do. And that's not really what people are doing. They are finding some relief of symptoms with too much drinking, too much substance use and abuse. What we have to do in my profession, and I think across the medical professions as a whole, is help folks to understand, one, how those behaviors, drinking, etc., can become dysfunctional. But we also have to help folks to supplant those what me and my profession would consider negative behaviors, drinking excessively, etc., supplant those with something else that works better. And until folks either hit rock bottom with excessive utilization or figure out and find a better way to manage their emotions, guess what? They're going to keep drinking. They're going to keep smoking weed. They're going to keep doing heroin, coke, and all that. And then you get into the addictions where people are there. So we've got to help folks to figure out some other alternatives to excessive utilization of other substances. I, in my own practice, work with clients all the time who are in that mix of struggling to find other ways of dealing. Some of that also is external expression of emotion. So, for example, yelling at your kids, in a bizarre way, nobody wants to really yell at your kids, but there is some symptom relief when you're yelling at your kids. Again, not necessarily healthy for you and definitely not healthy for your kids, but there's that. And so we have to help people to unlearn those skills, or create alternatives that actually help them to feel better and create no harm for other folks in the course of doing what they do. And so I will give you my personal Lawrence James soapbox around behavioral health. I think most of what we tell people in behavioral health, and some of my psychology friends who may be on here may disagree with this, I think is a load of BS. It actually isn't beneficial to people. And when we tell people, go through cognitive behavioral therapy as an example, I actually think it's probably one of the more dysfunctional things we can tell people to do. And you're going to ask, well, why, Dr. James? For a couple of reasons. The first is cognitive behavioral therapy asks you as an individual to think your way through an emotional problem. Listen to what I said. Cognitive behavioral therapy asks you to think your way through an emotional problem. I underline emotional. Cognition, which is thinking, can actually play tricks on you. It's not as infallible as we think. Thinking is really good for solving analytical problems. It actually sucks at solving emotional problems. There is an emotion-based system that actually has a logic to it. that we in my profession should be asking people to, one, learn and understand within themselves and utilize to help solve emotional problems. So using emotional solutions to solve emotional problems rather than using cognitive solutions to solve emotional problems, right? My favorite line that I tell my patients when I'm trying to explain this is, you know, when I sit and watch basketball, especially back in the day, because I'm of an age, you know, I'd watch the game and I'd be sitting on my sofa and I'd be crossing over, you know, putting the ball between my legs, going behind my back, and I'd go up and I'd pretend that I could dunk the ball. Well, the reality is I can't do any of that. But in my mind, as I'm watching the game, I could soar like Michael. In reality, I'm 5'6" and I can't go to my right. That's what's real. And I can't jump. You know, some black men can't jump. And so that's the fallacy of brain. Emotions, when we listen to our emotions and get in touch with them, because, and this is the hardest part of what I try to teach people to do. This is really hard. Most of us are clouded about what it is that we're feeling in any point in time. And so that takes work to really sort of self-assess and self-analyze. What am I feeling today? And so the work that I do really focuses on what is somebody feeling in a particular situation. And when they come up with solutions, I ask the simple question, what would make you feel better? Now, what do you think will make you feel better? Like, trust in your soul. What would make you feel better? And I continue to ask that question until people can kind of get to it. And when they sit down and they step back, you know, maybe breathe a little bit, be mindful a little bit, they often come up with solutions that help them. And the next ask is, let's try it. What's interesting about this, and this actually plays into, you know, kind of health-seeking behaviors across the board, is most people will not actually, even when they have a sense that something would be a better solution, will not engage in it. Mostly because of fear, right? The devil I know is better than the devil I don't know. People know that drinking works. That's why they continue to do it, right? Even if they go, there's some downsides to it. I'll only drink on the weekends, you know. I'll hold myself to 2 beers instead of 4, because it gives them that relief. And unless we can help them to find something else that actually works better than drinking or drugging, they're going to continue to drink and drug. And so I work with my patients over time to help them to figure out what are the solutions that emotionally feel right for them, that create less harm for themselves and less harm for other people. That's the journey we're on in behavioral health. And that's, I think, where we have to get to and change. And as we think about folks coming out of the pandemic, being aware of emotionally, what are you feeling? The first time I went out of my house after I'd gotten vaccinated, I was really very uneasy about it. And I remember asking myself, I'm like, all right, Lawrence, what's going on? What are you uneasy about? You're vaccinated. You're fine, right? And I'm like, well, I feel really uncomfortable not being unmasked today. And I listened to that. And although, you know, all the evidence said I didn't need to wear a mask, I kept my mask on because that's what made me feel more comfortable. And even I was at the golf course earlier today, I had my mask, you know, not because I need it, but because I feel more comfortable having it available to me. That, and if I go into the store, God knows if I can actually walk in there without a mask on. But I think listening to what my soul told me I needed to do and acting in accordance with that helps me to feel better emotionally. And so for all of you in your own personal lives, I would suggest listening to your soul, listening to that inner voice emotionally about what makes you comfortable in life is really important. That's a part of a solution. That's a part of one's toolkit. There are other things that I think Dr. McGuire will be talking to you about that can also be beneficial, but that's just a part of many solutions that are out there that I think are useful and helpful to people as they move forward in their lives. So I know I've been all over the map with you guys this evening. I appreciate you listening, and I'll shut up and I'll answer any questions that you may have, or would love to hear your thoughts and reactions to what I've been talking about thus far.
Thank you so much. That was
Absolutely.
really, really something that we all need to hear. And we're going to get into how we can use CBD as a tool, because Dr. Uh, Lawrence James talked about other tools that we can offer those who are dealing with stress, anxiety, post-traumatic stress syndrome. But again, this really confirms that we have something that one can use instead of alcohol, or instead of abusing any other substance. We have something. We're going to go through CBD and how it does really help to normalize or balance our emotions, to help to normalize and balance, our sleep and all of those other things. I'm going to take a couple of questions for you, Dr. James, and if there's any questions, you can put it in the chat. If not, then we want to, yeah, people are agreeing that it's a method to this madness and why people do what they do. Margaret is saying very interesting points that you made as well. But we'll let folks get their questions together. I'm going to share my screen right now, and we're going to talk about cannabis. We're going to talk about how this plant can absolutely be a tool, one of many tools that we can help those with mental illness. When we talk about the plant cannabis, many times it still has a negative stigma with many of us, right? Even myself, 4 years ago when I first heard about CBD and I knew that it was sourced from the cannabis family, I was like, absolutely not. But what I didn't know was there is a part of the plant that was and given has the ability to give us the health without the high. That's a hemp species. That gives us very, very small amounts of THC, or delta 9 THC, as we all know, is the compound that gives us the high, the euphoria, the paranoia. But hemp has large amounts of CBD, or cannabidiol, and that's what we're going to talk about tonight. So I had no idea that this plant had a species that would allow us all to have a holistic way of addressing our health needs. And so when we look at CBD, it's one of 118, 120 compounds that the cannabis plant makes, but CBD really is the hero. CBD offers hundreds and hundreds, maybe even thousands of benefits to the body. And tonight, what we're going to focus on is the benefits of mental illness. The benefit of CBD being a compound that can relieve us from stress, mood disorders, depression. It is something that is very needed to help us sleep, along with all of the other many medicinal benefits. And then there's other cannabinoids like CBC and CBG, and of course our Delta 8, the new kid on the block that we all love here at Wakana. But the synergy of all of these compounds coming together on a cellular level is really what helps those who have mental illness. When we look at CBD as it relates to depression, we know that there are two very well-known neurotransmitters that the brain produces or releases, and that's serotonin and dopamine. There are receptors that when CBD binds, it helps to release more serotonin and dopamine. And these are neurotransmitters that are really important in modulating and regulating our sleep, our appetite, our mood. Serotonin helps to inhibit pain, and dopamine motivates our behavior. So there are studies that show that absolutely CBD can be a tool for those who have depression, even PTSD and anxiety disorders. We all talk about the fact that post-traumatic stress disorders, Dr. Jane mentioned, is not just with veterans. You know, all of us have had PTSD at some point in our lives or another. A loss of a family member, a loss of a job, a loss of a parent, the global pandemic, you know, and the way that the CBD and other cannabinoids work to promote a reduction in stress, to promote reduced anxiety is through the endocannabinoid system. We talk about the endocannabinoid system all the time, and it is a very vital regulatory system in our body that promotes homeostasis, that promotes balance. And it's these receptors that are found throughout our entire body, our brain, our central nervous system, that when we consume CBD, it helps to address all of these symptoms that we see in PTSD: a heightened sense of danger, hyper alertness, irritability, which can lead to substance abuse, alcohol abuse, insomnia. Just all of these symptoms can be addressed with CBD. Now, what I love showing, because I know there are healthcare professionals on the line, is studies that really back up what Dr. Rita is saying, right? This study talks about the antipsychotic effect of CBD, how they watched and looked and did the data that really shows that CBD can be a tool for those who have psychotic or psychosis, schizophrenia. We know that many times that when physicians, psychiatrists, particularly start patients on antidepressants, you know, it can take up to 4 to 6 weeks for that to kick in for someone who is depressed. What typically happens? Well, that person gets very anxious that they're not feeling better. Then they start to then proceed to either have suicidal ideations or start to abuse substances. But what they found with CBD, which is really, really interesting, is that its action on the body is pretty rapid. Where it takes an antidepressant or an anti-anxiety drug 4 to 6 weeks to work, CBD in the studies shown to work very quickly. Within 5 to 7 days, we're really helping those people get relief from their mental condition. So there are ways that we can help those. We're not talking about making any claims that CBD will cure your friend that may have schizophrenia or anxiety or depression. But what we can say is that the studies do show that this can be a tool. This can be part of someone's toolbox. They're doing mindfulness meditation, yoga, they're walking, they're doing all of these things along with CBD to help their situation. So here at Wakana, we have a variety of products that I would recommend that you share with those who have issues with mental illness, anxiety, depression. Tinctures are placed underneath the tongue twice a day. I have a personal testimony for my daughter. Many of you know that she's studying for her MCATs. Those are the exam that you take to enter into medical school. And I'm telling you, she is so grateful that we have these products. She uses these products, as I do, twice a day underneath her tongue. These products have given her the ability to be calm, to be focused, and to really get this work done that she needs to get done during this time. So we have tinctures for those who may have drug screens. We know a lot of folks out there may have random drug screens. So we have a broad spectrum tincture, our pure products. We have a power line. Those are full spectrum line of products that have the legal limit of THC, which is 0.3%. And like I said, and I always recommend When you're starting CBD, always speak to your physician. You may be on other medications that can interact with CBD, but start low and start slow. Whenever you start CBD, start with 3 drops in the morning, 3 drops in the evening. That will allow you to avoid any unwanted side effects. And then there's edibles. You know, we offer coffee, a CBD infused coffee. We have gummies. We have products that, again, those who have random drug screens can utilize, and those who do not, we have our power products for them. We have our Delta 8. Delta 8, I know Jamal Hackler is on the line as well, but our Delta 8 is another way that those who like THC but want to legally consume a cannabinoid that will give them a little bit more potency than CBD, that Delta 8 is for you. It's almost like uh, extra strength Excedrin or Tylenol. If you need that extra strength, that Delta 8 is what you are looking for. And then our smokable products. Smokable products are great for those who want that quick result, because smokables are able to get into the cellular level within 1 to 5 minutes. So we have cartridges. We have our Delta 8 cartridge. We have our pre-rolls, our CBD joint. We have our premium flower. What I love about the CBD joint is that I've had many patients that are smoking cigarettes still. I didn't even realize how many people still smoke cigarettes. But the CBD actually helps to cut the cravings. It helps to cut those nicotine cravings. And those who use this, each and every time they have a craving to smoke a cigarette, they take 1 or 3 pulls on our CBD joint. And I've had many patients that have cut down their nicotine intake significantly. We have a hair care line. These are some of the products that we know that stress and anxiety can affect the crown, hair loss, hair thinning. And our SOS product line is shampoo, conditioners, styling cream that is infused with CBD. We know that the hair follicle is something that can be affected by stress and anxiety as well. We have a beard oil for those men who want that beard to be nice and full. And then there's culinary products. See, there's all different ways of consuming CBD. You don't just have to smoke it. There's not just tinctures or gummies. We have spices. You may want to use spices as you are cooking food. We have a vegan butter. We have a culinary tincture and product that you can bake and cook with. So just a great way to get the CBD into your system. And then there's sexual health, right? That is something that is important to everyone, but particularly those who have stress and anxiety. It affects their relationship. So we have products that help those who have libido issues, erectile dysfunction issues. And again, these topical products like our CBD lube or our G-Spot CBD lube does not pass the blood-brain barrier. So even if you have urine drug screens at your job, random drug screens, topical products will not pass those blood-brain barriers. We have essential oils too. We have essential oils that are infused with CBD. We have a First Defense product that is a nasal spray that can be administered right to the entry point of many viruses and bacteria. So we have something for everyone. We also have a sister a product line of sanitation, uh, hand sanitizer, surface sanitizer. We know that many of us are really anxious, very stressed out about keeping our areas at work, at home, at the offices clean, killing 99.9% of different viruses and bacteria. And I must say that I just remembered that I forgot one slide, and that slide is our topical products. Our topical products, I know Dr. James uses a topical CBD product, you know, with stress and anxiety. I know it's for me. When I'm in toxic work environments, all of a sudden my neck hurts, my lower back is aching. You know, I was in one facility and I had carpal tunnel syndrome. I was close to getting surgery on my carpal tunnel. I removed myself from that facility and guess what? The carpal tunnel went away. So many of us will harbor stress physically as well. So we have products that you can use topically as well for that as well. So I want to open it up for questions, and Dr. James, you can chime right in. Jamal Hackler, Erica Zachary, my medical advisory board. Dr. James, we have a medical advisory board that we would love for you to be on. They are on the panel as well. You can unmute yourself and just chime in if you like. I have a question here, Dr. James. I met a clinical psychologist years ago named Gail Christopher, who taught a program called Emotional Mastery that was so helpful. Are you familiar with it or with her? She used to live in Chicago. What you are saying seems to be the same process. I've noticed that using a variety of our Wakana products has helped me with my physical pain and keeps me calmer and more mindful.
I actually don't know Dr. Christopher. Given the description, it does sound very much like what I've been teaching. There hasn't been a real push in the field, as I said earlier, to really focus on kind of emotionality as a primary focus for how we do behavioral health treatment, which probably seems really strange given that much of what we're dealing with is around emotion and emotionality. But I think that has a lot to do with history and coming out of a medical science that says, objective data and thinking have predominance over emotionality. But that's a whole long story from my perspective. I love the fact that you're using some of the Wakana products because, in my way of thinking, one, I trust my patients that they understand what they need to do for themselves. I'm there as a support system to some degree to guide and to ask hard questions of them, and to make sure that they're working their own programs. But I often will tell my patients, they'll be like, Dr. James, what do you think if I do this? I'm like, does it feel right to you? If it does, and I'm like, if it feels right to you and it ain't gonna kill you or kill somebody else, I'm like, okay, let's test it. I mean, because I think like with these products, it's a test and learn process. So learn what works for you, how you may need to utilize it to help you to get where you need to be in your life. And so I'm a big advocate of people being self-empowered because I don't, although I've had many patients for a very long time, my goal is not for you to be in therapy for the next 40 years of your life. I want you to learn how to self-manage your own life and figure out your own ways of managing your own emotionality. That's our goalpost at the end of the day. So the learning is really important.
There's a question about your book that will go into press in 2022. You want to let us know the name of that?
Thank you. I wish it were a book that was going into press.
Journal?
It's actually it's a journal. I'd love to be
I'm speaking that into existence.
Thank you. I will say I've actually written 2 children's books that are actually in process, looking at healing within the African American community and some concepts in that space that, God willing, will be published in the next 3 to 6 months. Kind of around some concepts around community integration and community interdependency and unity that I think hopefully will be really powerful exemplars for us as we move into, I think, a different space for us as a community, and hopefully some of the concepts in there will help us not to frankly fear each other and to be working as you are, Dr. McGuire, with others in partnership. Whether we were looking at that in terms of relationships with intimate partners, business, or just in a broad community sense, where we are more integrated and interdependent on each other. So I'm looking forward to that as I said, hopefully being published before the end of the year. With regard to the journal, it's going to be published. It's a special issue of the Consulting Psychology Journal that will be published, like I said, probably mid to late summer fall of 2022. And we're super excited because we've already gotten about 10, 11 articles, and usually there's only about 4 or 5 that'll get published. So we've had at least double the amount of folks who are interested in publishing on this topic. And I think that says a lot about where we are in the state of talking about leadership, and how to grow and develop leaders within the Black community. So I'm super excited that we're having this opportunity and that folks are so interested in the topic.
Thank you.
I would add the piece that I wrote on growing and developing African American leaders, that was published and is available. And if anybody's interested in receiving a copy of that, I'm more than happy to send that out to you, if you just give me your contact information.
Perfect.
Hi, so this is Erica Zachary. I was just going to chime in a little bit. So I am a therapist. I'm still working, so I'm sorry. I'm on my phone, not my computer. So Dr. James, you hit it on the head. Like, I've been so swamped with clients through COVID and everything else. But the really good thing about that, as you were talking, I was thinking about, and I said this to a client earlier, I have more African-American clients than I have ever had. And I've been doing this for pushing 30 years now. And so it's great that I'm a teletherapist. And so it's great that people have acknowledged mental health is important, right?
Yes.
And just really engaging in the system. And I had posted something on Facebook earlier that talked a lot about just focusing in on our mental health and how, as a community, we have gotten to we have harmed people in some way by saying, oh, pray it away. You know, God won't give you more than you can bear. You know, don't air your dirty laundry, and all of those kinds of quotes that we all have heard, I'm sure, before. And so I'm just really excited for where we are right now when we really need it, through all the people that we have seen be harmed, you know, George Floyd and all of those, you know. So it's just been it's been a tiring experience, but it's been a really, really good experience. Like I said, I'm still working, so putting in notes right now. But thank you so much for what you shared about harm reduction, because actually the person that I'm typing a note about, I've had so many people, they're professional people that have returned to increased drug use. They were never drinking before the pandemic, before all of the social unrest that we've had, but they're drinking now. And trying to get them to taper that back and really recognize why they're drinking, and really just, you know, just try to get them to focus on what's happening, and just telling them not to drink is not going to work. You know, we really have to do more than that, and try, like you said, try to replace those behaviors with something else that will work. So yeah.
No,
So
look, you're spot on with that. I think, you know, telling folks, you know, don't do that is not the answer. They already know that it's not helpful for them. And until we can supplant that with something else that's a more effective tool for them, and help to guide them through that process, they're going to continue to get symptom relief where they can, and that may mean drug and or substance abuse. You know, I love Dr. Zachary that you know that you're busy, and that
I'm a clinical social worker.
okay, that you're so busy, and that you know your client load is more Black and brown than it ever has been. You know, when I started my practice, I work out of suburban Chicago, and I put my office in a place where I thought I could frankly get middle and upper class Black and white folks to be able to pay for me to work with folks on the west side of Chicago who may not have had insurance. And fortunately, because of some changes in insurance, many folks, you know, were able to come in to see me via their insurances. So that's been great. But I think there's an evolution that's happening, that the stigmas around mental health treatment are decreasing, at least for some segments of our population, and people are more amenable to coming into treatment. And frankly, I think the stress levels are so high for folks. that they're kind of like, excuse my language, shit, all the stuff that I normally would do ain't working.
No, because
So,
it's a different population, just a
that's right.
different, like, I got professional people, nurses and other counselors and
Hmm.
therapists, and just people that I've never seen in practice before.
Yeah.
So, yeah,
Yep. Hmm. No, I think you're spot on. Continued good success, and thank you for the work that you're doing.
thank you. Thank you as well.
And we're speaking Dr. Erica Zachary into existence too, along with
I
all.
don't know about that. I'm not going back to school. I'm too old for that.
There is a comment here. Dr. James, do you mind putting your information in the chat?
I
Many, many
just did.
people are, oh, you did? Oh,
Yes, ma'am.
wonderful. Thank you. Thank you. Many people are looking for that. Yolanda works in the school system. She does very well during the summer months when she's off, but however, school year, I'm stressed. I suffer from insomnia, weight gain, and body aches. My doctor mentioned to me that I have to learn to do it throughout the school year, but haven't been successful. The stress has led me to declining health issues. This past school year has been difficult with COVID. My family and I are making changes to help me with my stress. What products would you recommend for me? Thanks. So Yolanda, thank you for asking that question. I would recommend our tinctures twice a day underneath the tongue, a gummy at night for the sleep as well. Those are the two products I would start off with. Start low and slow. 3 drops in the morning, 3 drops in the evening. I want you to connect with the person that invited you to get those products. And Dr. James, would you like to add some other modalities that you also include?
Yeah, I think probably two of the easiest ones would be some form of meditation, especially in the beginning. And I think it's important, especially when stress, happens, is one to identify what are the stressors. And you've been at this a long enough time that you probably know what are the things that are stressing you out. One, be aware of those and really work to. I'm a big believer in prevention. Let me say this. So minimizing getting into stressful situations as much as you can is important. I realize it's not always completely possible to do that. So one, I'd start with thinking about how can I minimize and prevent stress from happening. Second, it would be in those stressful situations. And my mom was a school teacher, so I'm and having worked in university, I know some of what that stress is like, and there's a good reason why I didn't do it, because I was like, oh Lord, it's too much. But take time out. Even if you're in the middle of a class, if you need a 5-minute break or a 2-minute break, you know, just tell them, hold on, you're gonna take 3 minutes, do some breathing and relax. And what may be ironic about that is your kids probably need that break too. So it may be very useful to take them through some kind of either meditation or mindfulness exercise, ostensibly to help yourself, but to help them as well, to kind of chill everybody out. And then I think, throughout the day, it's really important to have a routine, especially around things like sleep hygiene. Go to bed at the same time. If you know that, not that you drink, but if you drink and you know that that really messes up your sleep, manage that, so that you either don't do that. So just really managing your routines and really understanding for yourself what are the things that kind of keep you, in a good place in the summertime. I mean, you said summer is great. So, what things do you do in summer that can be replicated during the school year? Not all of them can, but there are some that could be effective tools. So I would just think about some of those things as you're heading into summer this time, and seeing which one of those things you might be able to employ during the regular school year.
Thank you so much. And I put your information in the chat. It was only for the panelists. So now the attendees, hopefully you can see Dr. Lawrence James information. There's several people that want to make appointments I'm seeing as well. Any other questions? Let me look on the Q&A. Any other comments from the Medical Advisory Board? You can unmute yourself. Give him a couple of minutes. I think everyone can see his contact. This has been great. This has been really a lot of insightful information, very powerful. Dr. James, we want to thank you for joining us tonight. And we look forward to speaking with you again in the near future. Are there any other questions or comments? Let's see, make sure. I don't think there is. So we're gonna get ready to go upstairs and deliver some COVID babies, but every Wednesday I'm here on call. But for our guests, thank you for attending. Please connect with the person that invited you. For our business partners, please share this recording. So much information that we talked about tonight, but absolutely CBD can be used as one of the many tools in the toolbox for those who suffer from mental illness, stress, anxiety, PTSD as well. So be well, be safe, and we will see you next Wednesday night. Thank you again, Dr. Lawrence James. We really appreciate you.
Thank you for having me. It was a pleasure.
Good night.
Good night.